Good morning, everyone. Today, our good friend Hattie is going to be talking to us about different things that have happened to her in an extremely interesting life. And I've got the very happy job that I'm very pleased to have of doing the interview. So, if I've not forgotten anything, I don't think I have. Okay, welcome anyone that we haven't. I'm not very good at the welcoming because usually Ray does it, so apologies there. But lovely to see you all. And Hattie, um,
Very
oh,
briefly,
oh,
we
hang on.
Oh, David.
don't know what the balloons are for. That's to do with my settings for reactions. But
Oh,
just note,
That's it.
Patsy, that we've got a few people who don't normally come to this meeting, so it might be nice to say hi to them.
Yes, hi, French Clark. I don't know. I know your face, but I can't remember your first name. I'm really sorry.
Kate, I'll
Kate.
change it. Just trying to do that.
Hi, Kate. Hi, Rosie, and hi, Daniel. And if I missed, no, I've said hello to everyone else. I think I didn't. I don't think I did say hello to you, Mariam. But hi, nice to see you. Um, okay, all right.
morning,
Welcome
Rosie.
everybody, and it's we're looking forward very much to hearing this morning from Hattie. Very interesting life. And Hattie, I wonder if you'd be kind enough to start us off by giving us an idea about what made you choose your career in medicine. I know it's a long time ago now, but
Some memories are sharp, and every now and again you get asked this question. Did you want to do it since childhood? No,
okay.
no. Um, at primary school, I wanted to be a nun or a poet. Anyway, come secondary school, you're choosing your subjects for O level and A level, and so I just said to myself, well, what can I pass exams in?
Yeah.
What do I like? And what am I actually good at? So those were my three questions, really.
Mm.
And so from O levels, which was quite a broad brush, you get about eight or something I got. And then choosing the A levels using those questions. And I wanted to keep broad again. So I did English and I did maths and it was physical science. So it was a new combination of physics and chemistry. So our textbooks were pieces of paper, sort of treasury tagged together, ronioed off last thing at night by the poor teachers. Anyway, it was a Nuffield project, and we were sort of part of the guinea pigs in our science at that time, and the teachers all participated, which was great. I mean,
Mm.
I loved that. Anyway, so also in school, I was boarding, we had useful work. And sorry, it sounds like digression, but I looked after the careers cupboard or room. It was a room. And so I could read all sorts of leaflets about all sorts of careers.
Mm.
And I thought, and there was one set of leaflets, numbering hundreds.
Yeah.
And I just went through them and picked out 20 something that I fancied and
Yeah.
had a little read of each of them. And I thought, well, physio fits the bill because it's, no, occupational therapy, because I can do science subjects. I like people and I can pass the relevant exams. So I thought OT. And Mum very kindly went to see the best OT school in the country, which at that time was Oxford. And she went there and we had our usual Friday evening chit chat on the slot machine, press A to press the tuppence in, and
I remember that
had a
one.
telephone call every Friday evening. And from boarding school. So she said, Hat, you wouldn't like them. They're all colonels' daughters. So I thought, I trust you, Mum. I don't think I'll go and do OT at the moment. So then I thought, well, okay, physio fits the bill. I like using my hands, I like people, I can do the science. And I had a look at the physio careers information leaflet.
Right.
And when I read it, it just sounded like a crammed medical course. And then you tack on the physiotherapy afterwards.
Right.
And I thought, well, may as well do medicine. And then my options are open after that.
Yeah.
So it was a kind of, well, I may as well approach. And that's how I moved into medicine, in fact. So there we go. Anyway, I like it. And I
Well,
loved every minute of it until I was told that I couldn't go back to medicine because of head injury in 2010. I had a head injury. I was not wearing a helmet. I need to shut this mobile phone up. I was not wearing a helmet for the first time ever, and I was knocked off my bike, and 3 centimeters inside the middle of my brain are now dead. And
oh,
when I tried to use that part of my brain, which apparently is used by GPs all the time, it wasn't there. So there's great silences in the middle of my consultations when I was retraining. And so my trainer said, don't think I can pass you as a GP. Let's ask occupational health.
oh,
And he welcomed me into the room and sat me down and said, I know exactly what the problem is. I've looked at your brain scan. And he said, this part of the brain is always used by GPs. You could be a different kind of doctor, but not a GP.
right,
Because
right.
a GP puts together the person's problems in front of them with everything else they know, like,
Yeah,
the book stuff.
yes,
And my brain was going like hunt, 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 can't cogwheel, can't connect.
yeah,
So
yeah,
there we go.
yeah.
And
How did
every
you
now and
feel?
again it causes me problems in my life, but
Did you,
generally I'm well.
yeah. Were you really sad about it?
Um, I sulked. I said, I don't want to be another kind of doctor. I only want to be a GP. And I thought, how childish, but it ruled me, so I didn't go back into medicine.
Right. What was your next career then, or next?
Muddling through, trying to enjoy retirement. The hearing aids bit came a bit later. First of all, I was the trustee for the SWAFT, Southwest Ambulance Foundation Trust Service, something like that.
Right.
Um, so I did that for a bit, being a trustee for them with great governance meetings with,
Yeah.
30 or 40 people there, etc. Don't know if I made any influence, but I think I did influence some things about trying to promote education about deafness and disability when
Hmm.
ambulance crews pick people up.
Right. Yeah.
I think that did a bit of, pushing the agenda forwards. Yeah.
Yes. Yeah.
And there I met somebody who knew about a hearing aid service that volunteers ran in Surrey.
Hmm.
And I contacted them, and by talking about it, I guess, and just picking people's brains, I found out about HIS, which is Hearing Impaired Support Scheme, and that's a volunteer group who go to people's houses when they're a bit too disabled as they get older, or they may
Yeah.
be just too disabled to get out to the hearing aid to the clinics, the NHS clinics. So that's the service we provide. We go to people's houses to service the hearing aids, and we all get trained and have a laugh.
And did your interest in the hearing aid business, so to speak, start with hearing loss yourself, or
Oh,
did it?
yeah, yeah. When I first came to Bristol, I was aware that I wasn't hearing so well, and I went privately to see an ENT person in Bath and asked what might be going on. And he thought he did know maybe what was going on, but the maybe was the problem.
Hmm.
So I tried a medication for months and months, and you just so want to get better, don't you? You so hope. And I said, I think it's making a bit of a difference, so I'll give you some more. So I did another 3 months, and I said, not so sure it's making any difference actually. So gave that for a lark and waited until it got bad enough to want referral for hearing aids because I worked with two GP partners who spoke very fast and very quiet, and it was so frustrating. And also by then, in the 2000s, we were having so many phone calls to the practice, and we did a lot on the phone, which was okay because we knew our patients very well. But the not okayness was that it went to mobile phones, and mobile phones aren't so easy to hear.
No.
And I'd have to apologise sometimes, say, I'm sorry, I can't hear you well enough to sort out your problem on
Yeah.
the phone. I'll ask one of the other partners to do that work for me. So I had to ask favours, and I didn't really like doing that.
Of course. No. No, I myself, like many people my age, I've got hearing aids, and I do find a lot of problems with them. For example, they can be quite uncomfortable. I don't really enjoy wearing them the entire day because my ears start to hurt. Is that quite, does that happen to many people in your experience?
Sometimes, I mean, you shouldn't really be hurting. Are you hurting in the ear hole or over the top?
It, in the ear hole. It's
Oh,
actually painful. Yeah.
oh,
After a few hours. No, not initially.
yeah, yeah. We'll talk about that separately, Patsy.
Yes. But I mean, also, I mean, like many people, I imagine, I acquired my hearing aids through the NHS. I've not never have been seen privately by anybody. I mean, would you recommend to people that they seek out private help at all, or any special part of the system? Well, or would they start off with their GP? What should they
Well,
do?
okay, you start with your GP because you need a hearing test. Yes, you can get a free hearing test at shops who charge
Hmm,
lots of money for hearing aids,
hmm,
and they do charge a lot because that's their profit.
yeah.
Um, and but you're not obliged to go to buy hearing aids from them, and even though you're under pressure, and unfortunately some people succumb. But
Hmm,
the difference between private and NHS is in order to make a profit, the private companies have to sell something different, and it is inferior. The the chip inside the hearing aid,
hmm,
and thank goodness that guy's had his awards given to him. But the chip inside the hearing aid is tiny, but it does a phenomenal job.
hmm,
And it analyzes different pitches. The hearing test tells it which pitches to amplify to match what you need to hear. And unfortunately, the private hearing aids don't analyze so many channels, as it were,
hmm, hmm.
different pitches, and that's how they can make enough money to provide private hearing aids. And people don't seem to realize that they provide the whole service, the hearing test, the fitting, the choice of hearing aids, and the follow-up and the batteries. They're supposed to provide all that under their NHS contract.
Hmm. Right. Oh, that's very interesting. So many people could do with hearing that, couldn't they?
Yeah, but
So,
the whole point, these private companies who provide NHS hearing aids are called AQPs, any qualified providers. And they are under the same contract as the NHS. But of course, the NHS end up with all the difficult problems.
yeah.
But the NHS do a good job. And I talked this week to somebody who went to their appointment for a hearing test and so on. And they've come away with hearing aids and they were singing the praises so much. I said, is this NHS or is this private you're talking about? She said, NHS.
Hmm.
So
Yeah. Yeah.
she's chuffed and she's got a mobile phone that she can up and down the volume and change the
Yeah.
settings and all that doodads that she really loves. Yeah, yeah.
Yeah. Yeah, no, I've been very happy with the NHS service with my hearing aids. I had to have my hearing aids I was in my mid 50s. and I started to lose my hearing, and so I've done well out of it, and I've been very happy. Um,
Mm.
but that's just me.
Patsy, could I interrupt a sec and
Yeah.
ask you to shift your screen so I can lip read you down to your chin?
Oh, I'm so sorry. I didn't realise I'd done it. Wait a minute. I've got you on. I've got it arranged so that I can see you fully.
If you have a look at the top right on view.
Yeah, hang on. If I move this onto gallery, oh my gosh, how did that happen? I must have sort of, yes, if I lean back comfortably,
Yeah.
yes. So,
Oh, lovely. Thank you. Thank you.
I'm interested. You mentioned lip reading. Is this something you'd recommend that everyone learns as they start to lose their hearing?
Joe, what would you say about that? Joe,
Oh, me?
hello. Yes.
Hello?
What would you say about learning lip reading? Is it a good idea?
Um, yes, I think it does help a lot to be able to see the face and expressions, but I find that a lot of it is guesswork as well because the English language has so many words and some of them look so similar on the lips. And sometimes, quite often, I get the word muddled up. And it's all about being able to see clearly as well. So I've got a visual loss. So if it's in a dark room, I can't see the lips very well at all if I'm too far away.
Hmm.
So for me, I have to be about 1 meter, within 1 or 2 meters
Yep.
proximity to be able to lip read well. So
Right.
it's all depending on different circumstances, but I'm not very good at it. But I did have a friend who was blind deaf, and she sadly died last year. But she was a brilliant lip reader, and she once told me she was able to tell when someone was from Scotland just from lip reading.
That's pretty good. Yes.
Yeah,
Yeah.
I would strongly recommend it. We all lip read 10 to 15% anyhow.
Yes.
And as you get more hard of hearing, you do rely on facial expression, lip reading. And when you're meeting a new person, of course, it's a whole new lips that you're reading.
Mm.
So you need to stick up for yourself and say, please, could you speak a bit slower? But not
Yeah.
exaggerated, not like this, because that doesn't help at all. But getting good light on somebody's face, asking them to speak slightly slower. Some people want you to speak slightly higher or lower pitch, but they may not know that. But you could ask them.
Mm,
It's all
mm.
about asking how best to communicate with you.
It's also for me an issue that people speak so much more quickly nowadays. Well, I do believe that they do. I don't know if this is scientifically correct,
I
but
believe it too.
it makes it so much harder. You have to work much harder to keep up.
There was,
Also, people's facial expressions, and I suspect their dental problems have an effect on how they speak because why my mouth moves differently these days because my teeth are slightly different, and it must be that bit harder. I mean, each person you must have to kind of learn that person's
you do,
kind of reading. Yes,
you do, yeah.
fascinating, isn't it?
Uh, yeah. There's a good book called Read This Face, and
Right.
it's not very thick, but it's got examples of facial movements in the language of English. And it suggests looking in the mirror, looking at your own lip movements so you can see for yourself what they come out like on you.
Oh, that would be very useful. Yes.
Yeah.
What
Yeah.
was it? Could you say the title again?
I think it's called Read This Face. It's by RNID.
Okay, got
Publish
that.
it. Yeah.
That's great. I know you've travelled quite a bit. If you're in a country where they're speaking a different language, how much harder? I mean, assuming you've got some of that language yourself, how much harder is it once your hearing starts to go? Does it make any difference?
I'm sure it does. I mean, I've only got moderate hearing loss. Joe's got quite bad hearing loss and finds Italian and French very difficult to get the kind of nuances that you need, don't you? You love Italian.
Yeah, I would dearly love to be able to hear different languages and speak them, but I just find it so hard to hear the accent.
Yeah. Yeah, no,
Mm.
I'm very sympathetic with that because I had a few short years of my life where I was able to make use of a friend's home in the south of France. And at first, I was in my late 40s. I had a wonderful time because I did have quite reasonable French. And then all of a sudden, I found that the French were telling me they couldn't understand me. I mean, I've always found the French were a bit like that anyway. You know, they like to make it difficult for you, but that's what I find. But there was no doubt about it. I was finding them harder and harder to understand, and it was, I guess, what it was I was perhaps a bit too old to relearn French with my changed hearing. Maybe it's that. I mean, I really don't know, but that's why I
Yeah,
wonder if other people.
I think that's right, Patsy. Yeah, I think you've got it. Mm,
It's a real shame,
yeah,
really. So,
yeah, yeah, yeah.
I know I haven't been asking you questions for very long, but I can see we've got such a lot of people here who are really interested. I'm thinking, would anyone else like to ask Hattie something themselves, something that they're particularly interested? There's so many fields here we're looking at. There's Hattie's medical career, of course, and there's also the issues of hearing, and I'm sure many other aspects of your life, Hattie, that I haven't touched on at all. What else do you do besides your work of his?
Okay, okay. Here
I'll
comes. I've heard that it's quite difficult to run your life if you've got more than 9 areas of interest. So every now and again, especially New Year, I review what are these 9 areas, and I have to fit 2 or 3 into each box. Anyway, I bet you would too. But recycling, environment, nature, garden,
Right.
medicine, people, science, and knowledge. I love learning things. Friends, family, travel, walking, and then music of all sorts and dance, all those.
Mm.
But Kate, I haven't really been to international, and you go to international, don't you?
And me?
International dancing, do you do, or did
No,
you?
no,
Oh,
not me. Is it? Anyway, Joanna, was that? No.
Kate,
Anyone? Kate, yes, I think you do, don't you?
do you do international dancing?
You're
Yeah, I'm muted. Yeah, well, I do circle dance, which
Oh,
includes
very
dances
international.
from all over the world. Yeah, yeah.
So where do you do that and which day?
So several days. um, yeah, French A, Thornbury, Muller Road. They're
Oh, wow.
the regular ones, and then I do go away for weekends.
Yeah. Oh, I must
Yeah,
ask you more about that because I love the music and I love
yeah.
the flowing nature of some of those dances is just joyful. Yeah. Yeah.
can you effectively do circle dancing when your knees don't work very well? Because
Well,
my knees tend to lock.
oh,
I used to love
luckily.
dancing, but you know.
Yeah. Well, several of the groups I'm in are aging, and people adapt. Some people can't turn, um, a fairly quick turn, and so they just stay on the spot. And some people can't do certain steps, so they'll sit out dances with grapevines that because they can get affect your knees and your ankles. But on
Right.
the other hand, I think it's good if you can do them to do them because it'll keep those joints stronger. Yeah.
Yes. Yeah. Oh,
Lovely.
that sounds.
I know there's one circle dance teacher. She's studied Greek dancing particularly. She's married to a Greek musician, and she says in the villages they would have their village dances, and everyone would dance them from the tots to the great grandmothers,
Yeah.
and with varying degrees of energy, and
Hmm.
that's that's just what everybody does. I think that's a lovely
Yeah.
idea.
I'm sure that happens in Latvia as well. Everybody dances all the time in Latvia and
Yeah.
sings. Yeah,
Right.
it's normal.
But it sounds to me like I should be visiting Muller Road fairly soon because that sounds like my nearest circle dance place. I'll stagger down and give it a go, I think.
Yeah.
Mm. But I
One
used to,
little point, sorry, on that. I wonder, just occurred to me that dancing, because the beat is often low,
Hmm.
might be something that, although you might miss some of the music, you can probably, especially if you're used to it, you can get the essential bit, which is the beat.
Yeah.
Even if your hearing is going, because it's usually the top bit, isn't it,
Yeah.
that goes first.
yeah,
Oh,
Joe,
yeah.
Joe, you love dancing, don't you, with good strong beats?
Um, yes, I like music that's got nice, strong beats to it, so I can hear the music. I have also got a neurological balance disability called ataxia, which means that I can't dance as well as I would like to. So
Hmm.
I often look a bit drunk when I try to dance in a coordinated manner. And so it's not very easy for me. But I still like to try and do it for the challenge and the exercise. I went to try going to do some Scottish dancing, which I found very difficult because it went very fast. And then I've been trying to go to some of Hattie's folk dancing, and the coordinator kindly devised some dances for me that were a bit slower. And so we're starting to find it's easier. And sometimes I like to go out to dance and trance nights, which doesn't require any specific following of a pattern. And I
Hmm.
just do my own thing, really.
Yeah.
So that's quite easy for me as well. And I can hear the music because it's very, very loud.
Yes.
So, but recently I also took up belly dancing as well to try and strengthen my stomach muscles a bit to help with my ataxia. And I
Hmm.
found that very hard too because it's about balancing again. So, yeah, but I do enjoy the challenge of them all.
Thanks, Joe. That's
Yeah.
great.
Yeah.
Yeah.
It's inspiring, actually. I feel a bit of a couch potato. Well, not a couch, but certainly a chair potato at the moment.
Yeah. I mean, at French Folk Dance Club, we have live music every week, and I can't resist going back. I've had a bad knee recently, and I just went back and for half an evening, hoping to get my knee going again, and I couldn't. You know, one dance just showed me, no, that's too bloody painful. So I
Hmm.
said to the guy, "Do I really have to pay tonight?" And he said, "No, no, all right, we'll sum it up." I said, "Why not have a new membership where people just come and meet their old mates and have a coffee?"
Yeah, pay half price or quarter price or something.
Mm, mm, mm.
Yeah. Yeah, I think knees are a terrific. I had no idea how much work my knees did, until relatively recently. I then found it really helped to lose weight. So I managed to lose quite a lot of weight. Yes, it
I
helped,
admire,
but
I admire that.
well, yeah, Yeah, I mean, how many years ago is it now? I don't know. 1988 was when I had to stop drinking alcohol because it was such a problem in my life. It was a disaster, in fact. Um, and whenever I really want to do something, I think, well, come on, mate, you did that. You can do this. So, yeah, I changed my diet and completely. I mean, I live on salads. I have enough to eat and I have a balance of proteins, but I live on salads and I'm not hungry, and I've lost 2 stone, so, which my knees are very grateful for, but they're not happy enough.
Wow. I'm really impressed.
I know, honestly, it's finding a diet that you like. It's you
Mm,
can
mm.
look forward to your meals, and they've got to be healthy. And then when you've worked that out, you've sorted it. You know, you will lose any excess weight. And if you don't lose it, you probably need to keep it on. I am sounding like a retired GP, which I'm certainly not.
Thanks, mate. That's great. Good. Carry on. Some other questions then. What else did you inquire about?
Well, going back to being a doctor, really. I mean, for example, nowadays find it really difficult to approach my doctor. My doctor. I haven't got a doctor. I've got a doctor's practice. I do not have the same doctor every time. And the doctor obviously is always in a hurry and often omits to notice important things like the fact I've got epilepsy. And they will cheerfully go on. And I have actually been prescribed drugs which aren't suitable for people with that condition. So that has actually happened. Um, so so to me, going to a GP nowadays is traumatic. To be honest, I avoid it when I can.
Mm, mm.
I have to be desperate, and there I am desperate, and I can't even get through. Um, what do you think has changed? What has made it so? Could you come up with a couple of reasons why things have changed? Because it did not used to be like that. I mean, even back in
No.
1988, I met an extremely sympathetic GP who believed me when I said I haven't had a drink for X, whatever, and supported me. It was great. I couldn't get that treatment nowadays unless I was very lucky.
Mm, mm. I do. I think having shared lists has created some problems. Having your own list is much better. And I've been in practices where we actively changed from having shared lists to having individual lists.
Mm,
And it was just so much better.
mm,
It took a lot of extra effort. It was a big financial investment because all the staff had to come in for 2 weekends in a row, I think, on the Saturday and the Sunday. Anyway, 2 weekends, in order to label all the paper notes with the doctors that the people normally saw. The majority was easy. Oh, I normally see that person. So do I. Ah, well, who sees them most? But so majority of decisions about which doctor these patients normally saw could be easily made. All the doctors were there, all the receptionists were there, and making these decisions and labelling up the records. So it should be possible. Practices in Bristol who've gone back to trying to have named doctors,
mm,
again, are much more successful. I think the doctors prefer it, and certainly the patients do.
mm,
So that was one hiccup. The realizing that actually continuity is incredibly important.
yeah,
It is something that admins, management just don't get. It is incredibly important, as you say, somebody who just knows in the background instantly that you're on anti-epileptic drugs doesn't have to quibble about how they're going to make a choice. And that's that bit of the brain that is matching up you and what you know.
yeah.
Um, and the person. So and then, I mean, COVID's had a lot to answer for because a lot of people left, and the deal that doctors had for night uh, night pay was
Yes.
great. So we actually got paid for extra for going to see people at night,
Oh,
and
yeah.
then that got taken over by businesses. So
Mm,
again, this creeping thing of being seen by doctors who don't know you.
Mm.
And it's okay in the night, but if it's creeping into all day long, that's different. It's a really different process.
Mm.
But you've created work. You see somebody in the night who doesn't know you, who says, well, you better check out with your GP, see your GP tomorrow about this. And you've already created work by seeing two doctors.
Mm. Mm.
So things like that have crept in such that you're seeing a doctor who doesn't know you, makes mistakes, makes assumptions, has to get to know you because they don't know you before. And that's half the consultation gone, just finding out who you are. They may be able to read and be able to read the computer. Your doctor could find out you have epilepsy because there's a box which has got a summary of all your old medical problems, but they may not have had time to read it or value it as important. So, and new doctors who have to spend twice as long doing a consultation. When I'm with friends in the casualty department, I just have to bite my lip. It's agony watching them go through all the damn questions and not getting to grips with what you say is wrong, what you are experiencing. There's two people in here. There's a medical knowledge person, and there's you. And this is you who's come. I
Yes.
get mad. But
It's very interesting, though.
those are some of the problems.
Mm. And I think you said that in Bristol there is a change, it's something of a change towards it being one doctor, one patient, rather than seeing several doctors.
Yeah,
Is
I
it?
know a couple of practices who are really trying to do that, and I think the government's trying to reward them for doing that now.
Hmm. Well, that would be great.
Hmm, hmm. Mm.
Yeah. So yeah, I mean, just as a patient, yes, I would really value that very much.
Mm.
I mean, there's also the relationship I find between the medical practice and the pharmacist.
Oh yeah.
I find that's, in my case, that goes wrong quite often. Um, I mean, the information is being put in at one end, but it isn't coming out quite correctly or in full at the other end. I don't quite understand that, but
Okay. I mean, there are a lot more medications that people can prescribe. There's a lot more tests that doctors can do. GPs were asked to take on tests that were normally done by the hospital, and therefore you have more risk associated with it, to be honest, because it's not the specialist doing the test anymore. It's not the specialist looking at the results anymore. It's the GP, mostly. Of course, they can do that. But I found, for instance, because I happen to take a special interest in rheumatology, I found that I felt confident at monitoring people's drugs for their rheumatology, for their joint problems, and confident in monitoring lithium, for instance, for mental health, because I had a kind of research type of brain and knew how the computer worked to analyze just a few people. So you felt like you were specializing in something. But actually, just, expecting GPs to get on with all the anticoagulation and all other blood tests to do with this, that, and the other it's very demanding. Actually, the GP has to have a lot more knowledge and has to keep up. And that's why when I wanted to go back into general practice, having retired and hated it, I couldn't. And I mean, I just devoted a year to trying to go back to general practice. I loved the reading and getting up to date again. I loved that, and that all that intellectual stuff was easy to do. I did a computer exam, passed that tick, and then you go on to seeing people who are acting patients. And for those consultations, the new training required a short appointment. You were penalised for overrunning, and you had to cover, I can't remember, 13 or 17 points that
yeah.
you had to cover during a consultation. But if I had known that person beforehand, quite a lot of that I wouldn't have had to spend time on.
Yeah, yeah, more effective altogether.
And they'd known me and whether I exaggerate or underplay or whether I a bit rude when mentioning certain things, or a bit brusque, or just walk away from them. Don't worry, I'm only going to get something. Or maybe I walk away with them and not telling them what I'm doing, but they've got a trust in me that they
Yeah.
can still stay calm and wait for me to go away and come back and say, I've just brought this to see.
Yeah.
So, yeah.
It makes so much difference having a doctor you can get in touch with when you want to, when you need to, and that you can trust.
But the new doctors that I have witnessed working, inexperienced doctors, I would say, they labour every point. I'm just going to, do you mind if I touch? May I now ask for, and it gets under my skin. I know it's polite, but it takes time, and it's I know I would have done it differently. I wouldn't have demanded or just done something. I'd say, I'm just going to take a blood test, but I wouldn't bother to say it might show this or it might show that. But don't worry, but we'll get in touch with you in a week. The receptionist will, and half of which are lies, because maybe the blood test isn't back in a week. And the other thing is that you 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 know, worrying somebody, it might be this, it might be that. You heighten the anxiety, and the person knows they're not going to see you again. They're going to see another bloody doctor again, because that's how the system's working these days. So they can't clarify anything with you. And it really, there are problems with giving GPs too much. Yeah. Anyway, I don't mean to moan, but it's, and expecting them to. I couldn't get my appointment short enough when I was trying to requalify. I like people too much.
The other thing that is missing, that I miss the most, is that there's nobody to put the whole picture together,
Exactly the
to
point.
say, this medication might interact with that medication, and you are on this, so that's important. However, because of that, maybe you should take less of this in order to take that. There's nobody to kind of get the picture together, which is, I find quite frightening, really.
It's very frightening, Marion. This week, I have been supporting a friend of mine who has been feeling dreadful. And he's been feeling dreadful for 2, 3, 4 weeks. Anyway, really dreadful. And he called an ambulance twice this week, and he had to go into the hospital casualty department. And as he said, the number of lies I was told was ridiculous. You'll see a doctor in 4 hours. In fact, it was 14 hours. We'll find you a bed. In fact, eventually they found him a gurney. He didn't get sleep, etc. Anyway, the second time he had to go in was yesterday morning. And no, not yesterday morning, sorry, Tuesday. And he was just feeling dreadful. All this time, as a friend with the doctor's head, I've been saying, I think you've got low blood pressure. Why do you always suddenly feel awful 1 hour after you take your medication in the morning? What are you taking? Anyway, so his blood pressure machine still showed very high readings. And a couple of days ago, his GP practice lent him a blood pressure machine just to compare. Well, his blood pressure readings were in his boots. So I'm glad I'm validated. But now, I mean, it's me. Oh, the consultant who saw him yesterday said, don't stop your blood pressure tablets. Your blood sugar's much too high with your diabetes. And he was a rule-bound guy. So today I've said, look, only make one change to your blood pressure tablets per day. Reintroduce them really slowly. Oh, should I take a whole one tonight? I said, no, you've taken an extra one this morning. That's enough for today's change. Just monitor your blood pressure all day with this new machine. So why am I telling him that? Because the doctor yesterday had no clue, even though Brett tried to tell him how awful he felt. Anyway, there you go. I just think it is about human communication. It's about, as you say, Marion, what tablets somebody's taking. you don't, as a GP, you don't get that kind of need to think actively about what interacts very often. But it's actually frantically important. I remember somebody going into a mental hospital, and I mean, he was in his 60s. He'd never had any mental illness before. It was very unlikely that it was a new schizophrenia. And I ferreted around and spent time thinking what it could be and realized the link with introducing a new blood pressure pill 3 weeks ago. And I decided one way or another I would have to get to talk to the consultant because the people, when I talked to the nurses on the ward, they said, okay, we'll let them know and they'll get back to you. They never did. So I phoned and I asked who was the person's consultant. And I did talk to them. And I said, look, I'm pretty certain that it's this medication. And I just think you should stop it. And I think his mental health will improve. Luckily, they listened to me. And he came out of hospital and he's never had any trouble since, that kind of story.
Yes. You do hear quite a lot of things like that,
I think it's rare, but it's serious when it happens. I mean, he was seeing people pointing guns at him from the top of telegraph poles, the crisscross type of telegraph poles. He just thought they were guns pointing at him and he was paranoid.
Yes.
Anyway, there you go.
Yes. But again, it is lack of communication, people not having time to read records, check things out.
And knowledge. It's the experience. You don't experience somebody to have new schizophrenia at that age. So what will it be? Don't just say, well, that's very unusual. Don't just say that. It's your job. You're looking after that person. And there's a sense of commitment, to your patients. I used to do extraordinary things. A patient was refused an operation one time in Liverpool because she was 6 pounds overweight, and that operation table couldn't take that weight. And they refused her the operation. I said, well, that's ridiculous. You can lose 6 pounds in a week or two. And she said, well, of course I can. And so I wrote and complained. And I said, this is turning this person down for an urgent operation on the grounds of not being light enough, and it's minuscule amount. Go, jump. So I think my complaint worked, but I didn't think it would. I just thought that I'd better give it a go.
I was wondering if anybody else wants to ask anything, either on the medical side, but if any other aspect of your career that you've talked about. Angela, did you?
I wondered, Hattie, did you practice medicine in any other country than England in your career?
Not per se, no. In 1973, I had the privilege of going to South Africa as I'd only done 2 years of undergraduate medicine, so I didn't know anything really. Hadn't put two and two together yet. And I was able to be there for weeks. When I arrived, the consultant who was running the mission hospital said, right, well, you're off to the clinic in such and such a place today. And the driver, here's your driver. I said, hang on a minute. I've only done physiology and anatomy. I don't know any medicine yet. But I think, then the next task later that day was you can stitch that child's forehead up. No anesthetic. No idea. The nurse offered me a tray of 100 needles.
Oh, God.
Just no idea what I was up to, but I could do stitching, so I did it, and the child was absolutely amazing. He didn't scream, cry, didn't have a parent handy either. So I think that kind of experience, and I was talking about this hours of experience that we had. So, and every other country I've been, sorry, I'm leaving that point, but the hours of experience I had, we worked long hours. And if I was in casualty, they were only 12-hour shifts. So I was interested to see what was happening after my shift, and I stayed on. But talking about other countries, as a medical student, we had Medicine in Society, which the medical students had set up, and we had speakers from different countries. So I heard about medicine in China, Vietnam, Cuba, socialist countries, and ours was not the only way that it could be done. I heard about a book called Doctors Without Borders and Médecins Sans Frontières. I don't know when that was set up, but around that time maybe. And I heard about child-to-child education, so that if you taught certain amount of children in school about, for instance, how to treat diarrhea, they should take the message home and they should teach their families and they should teach their neighbours how to look after diarrhea. And so these education programs, and I heard about now practical action used to be ITDG, ITDG, Intermediate Technology Development Group, and that started in the late 70s, I think. And of course, everything was printed on paper, but they would think up ways that children could be weighed in other countries where we didn't have, fancy weighing scales and certainly not electronics. And how to measure the height of children when you didn't have these little gadgets that sit on your head and stuff like that. And being such a practical-minded person, I love this kind of creativity of thinking. So though I haven't practiced medicine in other countries, I have been exposed to it.
Thank you.
Thank you. Rosie, Rosie, did you want to ask anything? You don't have to, it's all right.
No, I'm fascinated, Hattie. I'm just wondering how long you've been retired.
12 years.
Wow. It didn't sound like you've actually retired.
Hattie doesn't retire.
No, you're just not getting paid for what you do now. That's it.
But I think the little service I do is to provide my friends with a kind of a medical bouncing board, and part of this bouncing board is telling them I am not your doctor. I remember going to seeing somebody in our dance group, and she was just changing, and I said, "Oh, excuse me, what's this? This looks like a vein down here." And she said, "Oh, yes, it is. I think it is." And I said, "Well, it looks clotted to me." And she said, "Oh, I don't know. I mean, I'm not bothered." And I said, "Well, I am as a doctor. I'm a bit bothered that you should have a clot in a vein in that place. It's very unusual. I know I'm not your doctor, but I would strongly recommend that you go and see a doctor." Anyway, I don't know if she did, but I have had to find ways of saying things to people. Somebody might be walking past and I'll see a skin cancer, and I'm thinking, do they know about that?
Yeah.
Have they done something about it? So I might say, "Excuse me, can I just talk to you privately for a moment?" And yeah, it may not be relevant, but I just want to run this past you. I noticed, so I found kind of ways of trying to make it acceptable to intrude. Because it is a bit intrusive to have a bit of a stranger saying, "Oi, have you got cancer?" So I'm trying to tailor it so that they can listen to me or not, whatever yeah.
It's kind of a different form of medicine without frontiers, isn't it? It's a different
Like the barefoot doctors that exist in lots of countries.
Oh, yes. Yeah. Yeah, what experiences we had.
It's just such an interesting life, and I'm so happy that you're continuing with what you're doing. I wish you lived nearer to me.
On the end of a phone, for goodness sake. What I will say is, people say, "Oh, this must happen to you all the time, that people are asking your advice." And I said, no, they don't. And what's also absolutely great is that people don't abuse it. I mean, I've had one or two things happen which could be seen as abusive, but I just shrugged them off. A telephone call at 1:30 in the night. Luckily, didn't ring. Anyway, in the morning, I found this message, and it said, I really need to go to hospital, and I've called 999, and they won't answer me, and I want you to please, can you call the emergency services for me? And I thought, well, that sounds very serious. But the thing was, I already knew her, and I knew that my conversations with the ambulance service about her had been such that they have blacklisted her.
Oh, yeah, right.
So, I mean, but very, very unusual. I don't count that as abusive.
No, it's more like a distressed call than anything, really.
Her
That is
daughter's
awful.
disowned her.
It's like the boy who cried wolf, you know.
Oh, absolutely.
99 times it will be a complete waste of time, and the 100th time it will be something serious, and they won't pay attention.
Yeah.
Yeah. Mhm.
We've just got time for another question or so from anyone. David?
I just want to ask, is it some... Oh, sorry.
Sorry, you go on, Marion.
I'm fascinated by all this. My father was a pharmacist, and we knew all the doctors in town. He was Mr. Boots. And my mother was a nurse who had measles. Is it measles when she was young and lost a lot of her hearing? And so I grew up with somebody who had real hearing difficulties. So I'm really sympathetic and appreciative. And I hear what Joanna is saying about making yourself visible so that people can lip read. I'm very conscious of that. I think, funnily enough, Zoom conversations have helped because we're actually more used to seeing ourselves speaking and perhaps more aware of how conversations are with others. It's all fascinating, isn't it? And I love it that you've just got such a wide range of interests, Hattie. That's lovely. It's just truly inspirational, and wanting to get sort of more active. I feel I've been a bit closeted these last few years, focused on just desperately kind of trying to get a community project off the ground.
Good, David.
And afraid of taking focus away from that. Whereas in the past, I mean, I grew up, spent a lot of time in this country. I spent some time in America, but there was a long time when I was, working around the country, and I'd got a sister in the Lake District, and the phone would ring, and it would be, "Are you coming this weekend? Bring your tools." And I've been sitting around the country and walking everywhere and having fun. And I feel I've become a really boring person and a bit closeted, having lost out on a lot of that. So I draw inspiration from these Friday talks. I think that the thing that I want to have an electric car so I can be pristine, pure electrically, but able to travel around more. And
yes, that would be great.
and I would love to say the one thought that came up earlier, it was just kind of peripheral, and is that there might be some possibility for, I mean, I could see exactly what you're saying about the personal contact of a health care centre with people. And I can also see the difficulties we have in maintaining that in society. And I'm sort of wondering if there's room for one's techno companion to know one's health records very well. Not that the hospital or the doctor has got good health records, but that you've got good health records, and that you're. So what I'm noticing at the moment is I'm able to. Anybody can do a Google search, but now you can ask a general question and get more or less a master's level piece of research out of a computer. And it should be able to know you as well, and not just keep track of your records, but be able to give you, genuine personal counseling and advice. Have you any thoughts on that?
Yes, I do. quite a few years ago now, I heard about health managers and they are or individual health managers, and I believe it was Singapore. I may not be right, but um, if you've got a condition like diabetes or asthma, you have an intermediate person who is not necessarily the nurse or the doctor, but somebody who knows you and knows how you're getting on and can help you navigate what's available. And I thought that was actually quite appropriate for a number of people. I mean, starting from the bottom, 1% of the population contact their GPs every day.
Wow.
Exactly. So you don't even contact your GP once in 100 days, do you?
No, no.
So there must be quite a number of people who need, for whatever reason, to contact the GP surgery for frequently. And it could be that they need a nurse or a doctor or another service that the GP practice happens to house, or some information or whatever. Yeah. But, it's not you and I who are building up the bulk of the contact with primary care. Sorry, I've kind of deviated from your thinking, but having a person who can help the bunch of people who do need to contact the GP surgery often, by somebody if somebody can manage it or help them manage it by knowing what the system is, who to contact about things, how to contact them about things. Yes, I can see that could reduce the workload considerably for some patients' interaction with the health service.
I sort of didn't realize it as a kid, but because my dad was the Mr. Boots, we just knew all the GPs. They were sort of in and out the house all the time in a kind of way, and yeah, I would love to see a healthcare system that was far more personalized and where we were getting real advice on not just health, but what the NHS does fantastically is it'll pick you up off a street and nurse the damage, get you through your trauma or whatever it is, and get you back and moving again. But it's how can we make best use of our time here and best use of our health? And it would be lovely to see the whole healthcare system shift up a level in some way. And funnily enough, I mean, the revolution in technology that we've got, which is threatening to put, on one side, being seen as threatening to put people out of work, is actually threatening to give us far better access to information and far more time to be able to, be up close and personal with people and real and connected. And I'm just hoping that we will seize that opportunity.
I mean, let's just refer to Cuba for a moment, because Cuba has had no medicines for years now, with the blockade, which is worse now than it has been and continues, and has been over 20 years, over 25, I think, by United States preventing imports and penalizing other countries who import. And the consequences are that they have a very good education system, so that a GP has 600 people on the list, or had, I don't know what it is now. GP here used to have nigh on 2,000. The GP would go to the family home. It was a bit intrusive, and this is part of the expense of, emotional expense, and why some people object and say that Cuba is a very oppressive country. But on the other hand, let's have a look at the good consequences. If a doctor knows you, they also know how to help manage things behaviorally and family wise for you. They also, for instance, if anybody had HIV, there would be visitors to the house straight away, and anybody with HIV had to go and live in an HIV house. No question. No question. That's where you're going to live. You're going to be trained to promote health and help people avoid HIV because we have no medicines for HIV. So you are now going to be recruited to teach people how to avoid HIV.
Right.
And, they had to run things differently.
Yeah.
It became much more personal, and people hated to be sent to a maternity home when they were pregnant. But that was the place they could be fed adequately, their blood pressure could be monitored. Otherwise, it wasn't going to happen because of distances and times and so on. Anyhow, so yes, very annoying, some of the stuff that they had to do and that they said they had to do. But also, that's how Cuba got neonatal deaths down. Not with medicines, with people.
Yeah.
Well, thank you very much, Hattie. Excuse me. I don't know if anybody wants to nip in quickly with one more question, maybe.
So one more thing about Cuba. The neonatal death rate was second to none. It was tops. It was second in the world. It was hovering right at the top.
Is the climate quite good in Cuba?
What is?
The climate. Is it a good, an easy?
It's temperate. I mean, it's about the same as ours, except
Yeah.
they have hurricanes and stuff.
That's strange because it's a lot further south.
Maybe it's temperate, but a bit, warmer overall. They don't have snow. Well, very rarely.
I wanted to ask a kind of cheeky question, really. I wanted to ask if there were things on your kind of bucket list that you really want to do, and what would they be?
That is quite difficult because when I think of a bucket list, I think of holidays. And I've promised that I'm not going to fly again. Yeah.
I
And
didn't mean just holidays.
no, I know. I wish I did. But I mean, the bucket list this year is get more familiar with my garden and get growing more veg and self-sufficiency that way. And that's working. And I have this system where I don't tell myself what to do. I try to persuade myself what to do, and I call it melting. So I change my mind by melting. But no, I wouldn't say I have a bucket list ambition, Marion. I wish I did, but I just muddle through. And one thing I learned a long, long time ago, if you have expectations, you get hurt. Perhaps that's why I don't have.
I just wanted to say that Hattie has got a big plan to hopefully go to Latvia with me this year. I hope you're still doing that.
Yeah, we are. Yeah.
Would you not call that a bucket list ambition?
Yeah, I guess go back and see friends there, and I loved it.
Well,
That sounds wonderful.
And I'd like to go to London and see more exhibitions.
Are
Yeah.
you Latvian, Joanne?
I'm not Latvian, no, I'm British.
Okay,
full
right.
British, but
It's one of the few.
we have friends over there who are very nice, shared mutual friends.
Right.
And we were going to go, I think it was last year, because they have a huge big dance festival there,
Brilliant.
international dance festival. But I felt a bit daunted by the crowds, so we didn't go. But we're hoping to go this year, but it will be a bit quieter and more manageable, hopefully. And I would like to see more of that part of Europe.
Yeah.
And I've got a friend in Berlin who I used to have a house share with. So we're hoping to go through Germany, which I've never been to before, and hopefully see my old housemate over there. And she's very excited about the prospect as well. So fingers crossed.
Oh, that sounds great. Yeah. Would you be going by train?
Oh, yes.
Yeah. I love European trains. I've been enjoying myself. Anyway, I guess I'd better say draw this to a close. Thank you very much indeed. It's been a most enjoyable hour. Thank you very much indeed, Hattie.
Well,
Thank you. Yeah.
welcome and
And next week, David is going to be talking about resilient communities, empowering local initiatives. So everybody with a green agenda, come next week. This in May. May is going to be our last month for the first part of the year, and then we start again in September. So do make sure that you come in May, and because it should be great fun.
Right. And I'm definitely going to be speaking about renewable energy, but I could say up front as a pre-announcement, I'm not going to be beating people over the head about flight. I'll be saying things to reassure people about actually what we're doing for climate change. And I've been to Riga in Latvia, and it's just a wonderful city, a lovely culture. So I can perfectly understand wanting to go to Latvia.
Have you been to Riga? Have
Yeah,
you?
yeah. It's a beautiful city. I loved it.
Uh,
I had a wonderful time there.
yes, I have had good reports of it. I've
Yeah.
had a look online, and the buildings look very quirky
It,
and different. So
it's very,
that would be very interesting.
it's
But I
very,
hope to go
it's
entirely by land.
well,
It
that's
would take
good.
quite a long time. So I'm hoping to stop off in different places on the way through.
Oh, it's
That's
wonderful.
why we have this idea to go to Berlin and see my friends. So um, this is all part of the plan of not doing flights. So yeah. Um,
There you go.
Far more fun.
That's what our lives can open up. So yeah, traveling by land is great because you get to see the countries, and
Yeah.
Eastern Europe is. I would love to spend more time in Eastern Europe, partly because of the wonderful times I've had in the cities and country when I've been there.
But
yes.
if you go to Berlin, allow plenty of time because the whole of Berlin is like a kind of open history tour.
Mm.
Yeah.
Mm.
Yes. Yeah. Yeah.
we're
Well,
getting on to a different topic.
Yes.
Time to wrap
Yeah.
up.
I'll talk about renewable energy in Berlin next week then.
Okay.
Let's go for that. Okay. Thank you very much indeed. Thank you. All right. Bye, everybody.
Thank
Bye-bye.
you very
Thank you.
much.
Bye.
Great.